Hi, everyone. Welcome to Tuesday Tips and Tea with Linnea FNP. And my name is Linnea Baker. I am a board certified family nurse practitioner, as well as a certified health and well-being coach. I am so grateful for you guys for being here today. Today, the topic I want to talk about really has to do with our Western medicine healthcare system and being able to advocate for yourself. So this is near and dear to my heart because we just had a real scare in my family with my husband's health lately, and I'm going to break that down real quick for you. So I decided that it was important to pull out one of the recordings I had done that's in my vault with myself and my dear friend Traci, who is an acute care nurse practitioner as well as a cardiovascular nurse practitioner. She's double certified from Duke University. And back in July 2021, this is over 2 years old when I'm speaking to you guys, this topic was something that we talked about together. And I felt it was really important to bring back out after my husband's and my experience in the hospital over the weekend. So many of you know that we went on a trip to the Bahamas I was posting about that I had earned through the health and wellness company I work with, serving others, called Arbonne. And we'd been in the Bahamas having a great time, and my husband got sick at the end of that time. And obviously, me being a nurse practitioner, I did an assessment, made sure, could we fly back, talked with my dear friend Traci to make sure I didn't have any blind spots on getting him home. We came up with a plan. We were able to get all the way back home, but his symptoms kept getting worse to the point where he couldn't drink water. He couldn't get comfortable. The pain was getting worse. And I woke up in the middle of the night to hear him talking to me, and he could hardly talk in a full sentence because he was in so much pain. He sounded short of breath. So I put him in the car and we go to the hospital because I knew at that point we needed to go to the ER and figure out what was going on. I had high suspicions, as did my friend who's the nurse practitioner that you'll see in this recording, that it was his gallbladder, but we didn't have a workup yet. So I wanted to go in and just check on him and make sure, because he was in so much pain, right? And to go to the ER for pain management, for IV fluid, for what is called acute abdominal pain symptoms, acute abdomen symptoms, which is what he was exhibiting. He was in so much pain. He could hardly walk. He could hardly talk. Like, that was really serious. And when we went in, they took us right back and they did an amazing workup with an abdominal ultrasound, which is usually the gold standard diagnosis for gallbladder disease. And they did some labs. And the ultrasound was normal, guys. And the provider in the ER said, hey, probably viral. His abdominal ultrasound's normal. You guys should be good. But that didn't sit well with me. And I know I have medical experience, but I know you guys have been in a position where a provider tells you something and you don't really agree with it. It doesn't sit right with you. You feel like there's something else going on, but you listen to the provider because you feel they know best. Well, guys, I'm here to tell you, you need to listen to that intuition in your gut, whether you have a medical background or not. You know yourself best and you know your loved ones best, and you need to speak up. So exactly, that's what I did. I told the provider in the ER that I was not leaving until we had an abdominal CT because I felt like we were missing something. We've been married 20 years. We've been together over 21 years. I have never taken him to the ER for anything. I knew something serious was going on and it was more than a virus. So I asked for the next level imaging, which in this case was a CT of the abdomen I requested. You guys may not know that, and that's okay. You don't need to know medicine. You just need to say, what else can we do? What's next? What else can we look for? This doesn't sit right. I'm not comfortable leaving. Just expressing yourself and saying you want some further testing done is enough, as long as you fight for what you feel you need for your loved one or yourself. So I just very nicely requested the abdominal CT, and we did. And guess what, guys? Before I knew it, the surgical team was coming in and he was getting surgery that day. When the surgical team came in and looked at me, they said, thank God you asked for the abdominal CT, because honestly, this is normally caught on an abdominal ultrasound and his was normal. When he went into the OR, they thought it was going to be a routine gallbladder removal. But what happened was, during the surgery, his gallbladder was so diseased and so infected and so full of what's called like pus pockets, which is just infection, it actually disintegrated, which means it like perforated, it came apart, and all that infection came apart. Now, we were very grateful because it happened during surgery, not at home. Okay, so it was in a controlled setting where they were able to take care of it. He was already given antibiotics and given more, and they did a great job taking care of him and doing all the things. It was a very complicated surgery. It was more high risk because it was an emergency surgery, and then his gallbladder perforated during it. But he had an amazing team. But guys, if I had ignored my gut intuition, and if I had just left the ER that day and let the provider tell me everything's fine, it's probably viral, my husband may not be with us today. If I had gone home the way that gallbladder looked when they got into surgery, that gallbladder would have perforated at home. And when you guys may have heard of appendix perforation or gallbladder, when something like that happens, all that infection spreads in the body and you go into what's called septic shock. It is a systemic infection in the bloodstream, and he would have ended up with septic shock in the ICU, and high likelihood he wouldn't have survived it. That's how serious this is. So listen to your gut. I'm so grateful. I'm not here to impress you, just impress upon you to listen to your gut intuition, to be your advocate for your family members and for yourself. I remember when I was working in the pediatric clinic, I had a mama come in with a 6-month-old baby, and her husband was deployed, and I had taken care of her older kids as well as this little one. And she said to me, "Miss Baker, something's not right. I feel like he has pneumonia." And that's what she told me. And she had no medical background. And I did the entire assessment. I looked at everything, and I wasn't finding anything on exam. But she just had a bad feeling. Well, guess what? I took the time to listen to her concerns, and I said, okay, I know that you don't feel comfortable. And so the next thing we can do is we could do a chest x-ray if you're willing to do that, because the risk versus benefit of a chest x-ray, you get a little bit of radiation exposure. But if you want to know, let's do a chest x-ray and double check everything and make sure before we send you home. Would that work for you? And she said, oh my gosh, thank you so much. So we did. And he had pneumonia on both sides of his lungs. And I would have missed it if I hadn't been listening to her, if I had just gone through, checked off the boxes and not paid attention to what she thought. And that's obviously a zebra. These aren't common things, but they're things that are important in my over 25, 26 years of healthcare experience, from nursing to nurse practitioner to taking care of loved ones to my own health. You know yourself and your loved ones the best. Do not hesitate to advocate for yourself and listen to your gut intuition. So in closing, I'm just so grateful for so many things: the amazing nurses that took care of him, the amazing surgical team that he had take care of him. I'm so grateful I listened to my intuition and advocated for him. I'm so grateful for so many things, and most importantly, that he's still with us, and that we're going to be able to heal and move on from this, and that this could have been a lot worse. And so guys, I'm just going to share with you this recording that my friend and I did. And we have a combined, I don't even know how many years, probably combined over 50 years of healthcare experience in all the things, from inpatient, acute, ICU to outpatient, and all different areas, and all over the country as well. So take time, listen. You can always watch it again, go back to parts you need, but it's powerful, and it helps give you tools to advocate for yourself. And that's what I'm here for, is to serve you, bring you value, and help you along your health journey, whether it's in a holistic health and wellness space, which is where the lane I'm in now. But sometimes we have to address the Western medicine side, which I'm so grateful we have that, because if we didn't have Western medicine and all the tools and ability to do the surgery we did, my husband wouldn't be here with us. So thank you guys. I'm so grateful for you. Enjoy this recording with one of my closest friends, and please comment and give me feedback. Okay. I would love to hear from you. All right. Until next time, stay safe. All right. Hey, good evening. This is Tuesday Tips and Tea with Linnea FNP. And I'm Linnea, as you guys know, and we have a really awesome presentation tonight. We are going to have Traci Land, who's right here, who is a very dear friend of mine, and we won't even say how long we've been friends, because we know I'm 28 years old every year, right? 28 and you're 29, right?
Oh no, I'm 52 and owning it.
So Traci's going to be with us tonight. So you guys are really going to enjoy this. Traci is a dual certified nurse practitioner. She has her acute care nurse practitioner as well as her cardiology nurse practitioner degrees, both from Duke University. There's Andrea and Nana. Hey guys. We'll do our deuces. Ready? So Traci's here tonight. She can answer some questions if you guys want to ask anything, and we have some ideas of some topics we might discuss tonight. But first, just you guys know, when I do these presentations, I have to do our disclaimer. So before I let Traci loose, because this is going to be amazing, and I'm so thankful that she's willing to do this tonight, because this has been my dream to have her on one of these with me. Our disclaimer is that this is an important health topic we're going to discuss about general information, but it's not intended to diagnose and or treat individuals, and it is definitely not intended to replace any guidance from your personal health care providers, okay? So from there, I'm just gonna let Traci kind of take over and do her thing, and we've got Mia as our tech support, my daughter, so if you guys have questions and we miss it, Mia will let us know, so you may hear her in the background. Go ahead.
So I'm Traci Land. As Linnea said, I'm an acute care nurse practitioner and a cardiovascular nurse practitioner. Most of my focus is critical care medicine. I work in the intensive care unit, but I've also done cardiology, advanced heart failure, managed patients in the clinic as well as the hospital. And when Linnea asked me what I wanted to talk about tonight, I decided I think it's important to talk about your healthcare team and who the most important person is in your healthcare team. My disclaimer is I have never, ever, ever done this before, so bear with me.
But she's a total natural, and that's why I had to get her on here.
I usually speak to a live people that I can see their reactions, so if my jokes are bombing, sorry, in my mind, I'm hilarious.
I'll laugh for you, it's okay.
I'm hilarious. So what I want to talk about is the most important member of your healthcare team, and I'm hoping every one of you right now is going, well, the most important member of my healthcare team is me. And it is. You're the most important member of your team.
No,
you, the individual.
You
are most important. Are the most. I would like to think I'm important as well, but not as important.
We're important, but not as important.
You're the most important member of your team. I can't tell you how many times I've worked with patients who were taking their medicine and they felt miserable and didn't tell me and quit taking their medications and then come in even sicker. So what?
Nope, we're still on. We're good. We're still rolling. Go ahead.
I have no idea. So what I tell people is my goal is to keep you alive as long as possible, but I also want you to be glad you're alive. And the one who's going to know best if things are working is you. So if you have a provider who starts you on a medication and you're feeling poorly, don't just say, ugh, this medication is making me feel worse, I'm not going to take it anymore. Communicate with your healthcare team.
Thanks, Kelly.
And say, hey, this medication's making me feel awful. Is there something else we can do? The other aspect of being an important part of your healthcare team is not only listening to your provider, but communicating with your provider. There are times that our providers will tell us things that we don't necessarily want to hear, so negotiate. I'll give you an example. I spoke.
Absolutely. This is good.
I spoke with a church group one time, and they were all really mad. The pastor said, my cardiologist told me I'm not allowed to have fried chicken and collards anymore. And my response was, well, I respectfully disagree. You can have fried chicken and collards. You just can't eat them every day. But when you do have them, you have to invite me over so I can have fried chicken and collards with you.
That's good. That's good.
If you're not sleeping, these are the things you need to communicate with your provider. Those of you, if you're snoring, sounds
That's
silly.
such a big one.
So huge. You need to communicate that with your provider.
Talk about snoring for a minute and why it's so important, because that affects the cardiac side, and a lot of people don't get that. And the sleep apnea, you want to touch on that a little bit? That's just, it's something that people don't think about that aren't in the industry with us.
So this is interesting, is being part of your, being the most important part of your healthcare team. So sleep apnea goes undiagnosed quite frequently. Now, sleep apnea basically is two things. Either you stop breathing when you're sleeping, or the second thing is you're snoring so much you're not getting good breaths. What happens is as you fall asleep, I'm going to turn sideways to give you the lateral view. When you lay back, your tongue will slide back and help obstruct your airway. So for those of you who have husbands who sound like they're lumberjacks,
Are you okay?
Our tech advisor is dying.
We're losing Mia. She's laughing.
So for example, people who are snore, you're nudging them, telling them to roll over, and it improves because they've turned and their airway is able to be unblocked. But some people, if you have sleep apnea, what can happen is it can cause high blood pressure. When you're trying to breathe and not breathing, it causes back pressure. And that back pressure can cause your heart to stretch out, can cause the main artery that goes from your lungs to your heart to stretch out, causing what's called pulmonary hypertension, which can cause right-sided heart failure as well, can cause irregular heart rates. I'm sure you've seen all the TV commercials about, I have an irregular heartbeat, I have atrial fibrillation.
Yeah, it's popular now.
Sleep apnea is something that can cause atrial fibrillation. Now, here's where being part of your healthcare team is. If you get diagnosed with sleep apnea, they give you a CPAP machine. I don't know how many patients I've had said, I hate the CPAP machine.
Talk to my husband.
The CPAP machine.
Damon, I'm calling you out. Tracy's here. The last time we called you out was on your cholesterol in North Carolina with Tracy. I'm calling you out. The CPAP machine. I want you tuning into this. Go ahead, Tracy. Go ahead. Give it to him. Give it to him because he won't listen to his wife.
What I like to tell people is advocate for yourself. If you talk with your healthcare supply, so for example, if you've had a CPAP machine for the last 5 years, your technology is way behind. Talk with the healthcare supply company. There's newer technology, newer masks, newer fittings. They can try a series of different masks to find something that you're comfortable with and you can breathe and you don't wake up with your wife smothering with your pillow because you're snoring so much and she's not getting any sleep and is irritable.
And her husband too. We've talked about it too.
I wasn't going to dime my husband out. But
I'll dime him out.
But after the fear of being smothered to death by me, he did go get evaluated, and it's altered his life. The other thing is if you do have sleep apnea and it gets treated, you'll find you have energy like you never knew. There's always a misconception that if you're overweight, you have sleep apnea. Not always. I've had patients who were thin as a rail and had neck as long as a giraffe, and she had horrible sleep apnea. She came in with an irregular heartbeat and we didn't know why. So we looked into it and sure enough, she had sleep apnea. We started her on CPAP, found the right one for her. She came back and saw me.
Andrew said, that's Dan, her husband. And Lynn said, same here. So all of us females are in the same boat with our husbands.
and what I tell the husbands is the most common side effect you have is sore ribs. That's from us going like this.
That's exactly
and
it.
If they wear their CPAP machine, they won't have bruised ribs anymore.
Happy wife, happy life. If we get good sleep, then life will be better for them.
Yeah, or we're going to smother you with a pillow.
Or we'll smother you with a pillow.
Disclaimer, don't really smother your husband.
Yeah, don't. That was just a joke.
But I had an extremely skinny patient, and she had horrible sleep apnea. When I sent her to be tested, they all thought I was insane. She came back to see me 4 months after starting her CPAP and was... For a minute there, I thought she had hyperactive disorder. She was so energetic, said she hasn't had that much energy since she was young. She was back in college getting her PhD just because she had good restful sleep. And I'm sure Linnea has talked to her for better or worse. For better or worse. So the worst is me smothering you with a pillow.
Well, his thing is the beard. So he says but you said we can get him fitted for things that will fit better. He got fitted before he had the beard and he hasn't gone back in. So when we talk about being part of your healthcare team and doing the follow-ups and letting your providers know when something's not working, hence when you get facial hair and your CPAP doesn't fit right, you should go back and talk to your provider and get a one that fits better.
So sleep apnea, it's something to think about. If you find you're tired all the time, if you're falling asleep at the steering wheel, if you wake up and feel like you haven't rested, it's worth getting evaluated because the long-term health effects can be really devastating. Right now it's inconvenient, you're tired, but later on down the road, if you're looking 10, 15 years down the road, it can have really devastating health effects. Other aspects of being part of your healthcare team is being an informed consumer, okay? So that means, number one, don't believe everything you read on the internet. Don't believe everything you read on Google, but ask questions. If you have questions, ask your provider questions. Communicate with them. When you go in to see your provider, I tell all of my patients, keep a pen and paper with you. If they don't have one, I give them a pen and paper. Write down questions. Because I'm in the hospital a lot, I see families, and I work intensive care unit, I see families in the worst state of their lives. And I'll come in and talk to them, and they'll have 0 questions for me. I'll come back 2 hours later and they'll have had 20 questions, but of course we'll only remember 3 because they're so stressed out. So I tell people, write it all down, make a list. I do this.
I do the same for me when I go to my provider
Yeah.
or my family member's provider, because when you're the family member or it's you don't remember things the way you do when you're the provider and you're doing it from another role. So I absolutely totally agree. With my son with his cancer, I have a notebook. I wrote everything down and I made a binder of all his stuff to keep track. I had notes on my phone of what meds he was on, what his weight was last time, things that I knew they needed that I also was tracking. Be present in your visit. That's right. That's good.
Absolutely, yeah. Be there, participate, engage. So especially some of our older generations, they're raised, the doctor knows best.
That's true.
Listen to the doctor.
Right.
Don't ask the doctor.
It's a generational.
The doctor's the great wise. Now the doctor they're trained, they're
Or nurse
educated.
practitioner.
So I say provider.
Yeah, provider.
But the older generations were taught the doctor, but provider. They are trained, they are educated, they do know, but nobody knows you like you know you.
That's the truth.
And nobody knows you like your loved one. So you have to advocate for yourself. You have to communicate with your provider. You have to express your wishes. If they tell you to do something, you're like, I'm not going to do that. You need to tell us, because I'm going to think, yeah, I'm doing the best thing. They're going to be so cured, and they're going to come in, and you're going to be still broken. And I'm going to go, geez, I need to add more medicines.
And that's exactly what I was going to say, Trey. That's exactly what you were touching on, is that when you come back and we think it's not working, we go up. Like blood pressure. If you're not taking your blood pressure medicine, and I had a guy in Hawaii come in on 10 different meds. They kept piling on his meds because they thought his blood pressure wasn't controlled. It was because he wasn't taking them. If he had taken all those meds one day and decided to take them, he would have dropped and had a cardiac arrest from all the medication they had on him. I had to start everything over because he was honest with me and told me I don't even take them. But that was in the dynamic of him getting trust with me and me being willing to listen and him coming in and answering my questions and feeling safe. But you have to let us know what you're doing. That's absolutely right. Or we could really end up hurting you, and that's definitely not what we want or you want.
And another aspect is, we all know that prescription medications cost a fortune and can be cost prohibitive.
Absolutely.
So it's important to communicate with your provider. Hey, look, I can't pay for all of these medications, pay my rent or mortgage, pay my bills, and buy groceries. Many times I've sat down with families and we've looked at their budget and have gone through the medicines. Walmart has a $10 list. Most of the big stores, Target, CVS,
and they have lots of coupons and pharmacies. The different companies have programs too that we can enroll you in if we know.
I had a medication that my insurance no longer covers, and it was going to cost me $600 for a 30-day supply.
Yeah, which is ridiculous.
So for the first time ever, I opened an app that gives you a discount, and I went to the pharmacy and I paid $11 for the $600 prescription. So if you're finding that your medications are cost prohibitive and you don't want to mention it because you don't want them to think you're non-compliant, that's not it. Don't worry about what they think about you. You take care of you. You're the advocate. You need this medicine. Hey, I understand I need this medicine. Can you help me figure out how I'm going to get it? There are ways. If that medicine isn't the one, then we can find one that's similar that's going to be with a reasonable price.
Right. At the end of the day, if you can't afford it and you're not going to take it, it's not going to help you if you can't take it. And we don't want anything to be such a burden that it disrupts your whole financial well-being. There are programs and things we can do for you, because that's part of the holistic approach that we're trying to do. We're not trying to rob you of the finances you need to for your basic needs. We're trying to help your health. And there are ways we can do that as a team if we know, and we need to know.
I'm also a big proponent of goofing off. So you need to have some funds to be able to goof off as well. Because
did you see her shirt, the shenanigans shirt? What's it say? Shenanigator, a person who instigates shenanigans. This couldn't be a more perfect shirt for her.
This wasn't planned, by the way. I put this on this morning, and Linnea said, hey, we're doing a Facebook Live tonight.
Facebook Live tonight. Let's roll.
Okay. And those of you who know me know the shenanigator. So, yeah.
We're good. Oh, Wendy's on, Tracy! Yay, Wendy! We haven't seen you in forever. So shout out to Wendy, who's a fellow nurse who worked with us back in North Carolina. So really good to have you on here, Wendy. I got Tracy on. She may be a regular here. She's doing great.
She's humming a few bars and faking it, but with confidence.
Just look confident. It'll be fine. She'll give you grace.
Okay, so we talked about your medications. Diet. So here's the other thing, diet. Again, you're being told you're getting this, right? Shamey, eat this, don't eat that. Make good choices, but again, in moderation. If you stop everything, then you're not having any fun. But don't eat fried chicken every single night. But be your advocate. Hey, provider, I understand you don't want me to do this. Can I do this once a month? Can I do this every couple of months? What medications do I need to adjust if I'm changing my diet? Speaking of diet, I want to talk about herbals. Lots of good herbals out there that people are taking. I'm not advocating one way or the other for herbals. I think that's a personal choice. But again, communicate with your provider. Because a lot of those herbals will have a cross reaction with your medications. And again, I as a provider can be causing you harm if I don't know what you're taking. I'm not going to judge you. I've used acupuncture and Chinese medicine. I've traveled to China on a medical, as a medical ambassador. Went into hospitals where they use just Eastern medicine, just Western medicine, and Eastern and Western medicine. And I think there's a place for everything to work together. Because as Linnea was saying, we have to treat the whole body, all of you. So if you are using herbals, Chinese herbs, other types of vitamins, all of that is included in your medications. Let your provider know. We have ways of looking that up to make sure we're not giving you medicines that are going to cross-react.
Correct. Yeah, no, I think that's a big one, is when we say what's your medications that you're taking, people don't think of the over-the-counters and the herbals, and if we don't specifically mention, or they won't even remember what they are, or the names sometimes. So I like to, even for me, I'm getting older now, so we were just talking today about the medication list and how I'm feeling older because I have all these meds I take now. But the big thing is I actually put them on my phone in my notes. So when I go in, it's like my brain will go blank. So I'll put in if there were some questions I had for the provider about me, my med list, because I do this for a living and I still will mess up when I get in the office, and then I leave and I'm like, and then you can't get them on the phone right away. Even as a nurse practitioner, I can't always get them on the phone right away when it's about me. So it helps me save time and save the provider time by addressing the concerns I have and giving them my exact med list. And that includes anything over the counter. Go ahead, that was good.
Yeah. So when I talk about being part of your healthcare team, what I'm going to do is I'm going to share a little bit. I was diagnosed with a non-cancerous brain tumor about 5 years ago.
I didn't know if you were going to bring that up.
Many of you know, and so I had to have a multidisciplinary approach to find the treatment. And what I did was I had an acupuncturist, and I had physical therapy, and I had a brain surgeon, and I had my physician, and so I called them Team Traci. And guess who the captain of Team Traci was? She has 2 thumbs. She's this gal. That was for you, Damon.
I like that.
I'm the captain of my team. Now, I had one acupuncturist who was amazing, Lance Allen, Southern Pines. I'm putting it out there. He's the bomb. When he's out there going, woohoo, because she knows Lance Allen's the bomb. Then I saw an acupuncturist. I live in Suffolk, Virginia right now. And I saw an acupuncturist in Virginia who was crazy and causing me more harm. So I had to cut bait and dump her.
Yeah, we just talked about that tonight too.
Yeah,
actually.
and I told her, I was like, hey, you had a chance to be part of Team Traci, you blew it. Again, she's trained, she knows her business, but she didn't know me and wasn't willing to listen to me. So when I first was diagnosed, what happened was I woke up one morning to go to work, I got up, jumped out of bed and fell on the floor and went, well, that doesn't normally happen. That was unusual. Had horrible vertigo, thought I had an ear infection and went on my way. Then I started seeing people and they said, well, this will shock many of you who don't know me, but those of you who do know me are going to chuckle. I've had multiple concussions, which should explain a lot.
I'm not saying nothing. I won't dime you out.
So the doctor said...
Damon's laughing.
So the doctor said, we think this is post-concussive syndrome. I'm sorry, this is the way your life is going to be for the rest of your life. You're just going to walk and fall over on a regular basis. Well, as the captain of my team, I refused to accept that and said, no, that's not right. Something's not right. And I continued to push and continued to push until finally I got an MRI. And then I actually always ask for copies of my discs because I've been trained to read those things. And I was at home scrolling through my MRI, and sure enough, I went, oh, that's a brain tumor. And my husband went, that's a what? And then, of course, we discussed brain tumors. But if I had listened to everybody, this would have never been diagnosed. And if it had grown another centimeter, I would have had a massive stroke. So then the decision was, well, we need to have brain surgery. And the first neurosurgeon I said to me, said to me, well, normally we wouldn't deal with this until you go blind in your left eye or have a massive stroke. Well, at that time, I'm an ICU nurse practitioner, working daily, productive member of society.
Devastating.
So I looked at the neurosurgeon, and I've worked neurosurgery. And I looked at the neurosurgeon and said, that's not going to work for me. I'm a productive member of society. I thought we'd fix it before I become dysfunctional. And he goes, sorry. So if I hadn't advocated for myself, I would probably have had a massive stroke and not be here talking to you. So I went and found another neurosurgeon. And he looked at it and said, oh yeah, this has to come out or you're going to go blind in your left eye and have a massive stroke. And I said, agreed. Had the tumor out. It's been 5 years in April. No more tumor, less than 5% chance it's going to come back. I'm back to work, causing trouble, raising shenanigans.
I was just going to say that.
And encouraging other people to be the captain of their healthcare team. Pick your team members, support your team members, work with your team members, and advocate for yourself.
No, that's fantastic. And I had to do that recently with my son with his cancer diagnosis. That was a big, oh wow. What does that say, Mia? Part of it's
Yes.
Well, I guess we have to advocate for ourselves. Good for you.
Yeah, thanks, Kelly. It's true. We do have to advocate for ourselves. And I had to advocate for my son when he was in the hospital on things that I knew as his mom and knowing his baseline and knowing him, that I had to advocate for things that helped him in his cancer care, even though he had a phenomenal team. And it's okay not to agree or have a different personality. Like, there are different providers out there. So you can fire your provider and find someone else. You can do it in a respectful way. It's not because they're not necessarily... There doesn't mean they're trying to hurt you or they're not practicing based on guidelines, but people have different approaches, different bedside manners. And so I always told patients that, if you don't like the way I do things, that's fine. There's other people that may be a better fit for you. And I just want you to get the care that you want out of this. And you need to trust the person that's working with you. And I need to be able to trust you as well. So it's a two-way street, right? You have to build that relationship.
If you don't vibe, then find somebody that you vibe with.
And it's fine. It's not personal. I don't get upset if people leave me to go to someone that fits them better, because I get people that fit my personality and the way I do things better. So that's the way it should be.
And with that being said, if you are advocating for yourself and you feel you're not being respected or your provider's not listening to you, then like Linnea said, you can fire that provider and find somebody else, because you don't have a good team if you're not listening to each other. You have to listen to each other and support each other. But in turn, you have to make that agreement. If they're listening to you, you have to listen to them and have an open dialogue.
And meet halfway. If there's something they're saying that you don't agree with or that's not going to work for you, we do need to know that. And like Tracy said early on, like I tell patients this all the time in our education, like if we tell you this is the plan and we agree upon it and you leave, I see all the time patients and families will just, well, it's not working, I'm getting worse, so they just stop and they don't come back. Or they say that, I don't have, whatever it is. It could be a medication, it could be physical therapy, whatever the treatment may be. Maybe I send them to a specialist and they don't like the specialist, so they don't follow up, and then they come to me to treat it. And I'm like, but I'm not the person for this. You need to be with a specialist. But they didn't like the specialist and didn't tell me to put in like a second opinion or a new consult. So it's really important that you communicate with your providers, because that's going to help you get where you need to go the fastest and help us.
I'm pausing Linnea because Nana has a comment.
What does Nana say?
Nana says that you also don't know where they graduated in the class.
That's right. Nana, you're right. It's like Nana looked at my transcript.
I know, mine too. She knows my transcript from Masters. She knows where I was.
That's an outstanding point, Nana.
Oh, that's great.
But
that's awesome.
It's also the type of person. I mean, you guys know this. You have people that you want to hang out with, and you have people you don't want to hang out with.
And you want someone on your team that you want to hang out with.
Exactly.
And also, I would say, like you said, someone who's willing to listen.
Yeah.
Like if I go into an office, because with my kids and our family dynamics, if I've gone into a specialist or an office and they talk at me, not with me, and they're so busy talking about everything they're going to do to me and at me, and they've just looked on some papers and they haven't had a dialogue with me and they're just assuming things, that's not a good fit for me. Like, because how important is the history in what we're doing? We talked about this recently too.
Yeah, so whenever I see a new patient, I sit down and say, tell me what's going on. And it's amazing. Just the most subtle thing that you tell me may give me the answer to what's going on with you. So taking the time and telling your story, making sure somebody's listening to your story.
Kelly says, we need Tracy on our bond team. She is so fun.
Yeah, I'm working on it, Kelly. Trust me. That I'm definitely.
And Andrea says, having a provider who will listen and truly get to know you and your family member is so important.
That's absolutely true. To
Makes-
both of you guys. Yeah, no, I'm so glad. I love this dialogue back and forth. So one of my things with Tracy is, she's going to be part of the Arbonne team because she's a natural fit. She just doesn't realize it yet.
She doesn't know it yet. Yeah.
Because we love her, and we've been sisters for years. And you haven't met the third part of our party, which is Jackie, and I got to get her on here too because she's also a critical care nurse and friend of ours and sister. The Three Musketeers, right?
Yes, the three of us were ICU nurses together in Texas, and yes, the building is still standing, just despite our efforts.
Well, you know.
And I have to say, valuable members of Team Tracy, you know, we gave a shout out to Wendy. Wendy is a huge member of Team Tracy.
Yes.
She was there when I was diagnosed with my brain tumor, and her husband were amazing. The night before my surgery, called me and wished me luck and supported me the whole time.
She absolutely is part of
Jackie
Team Tracy.
came and stayed with me in the hospital to help me through my brain surgery and keep me from mowing the lawn 3 weeks after my brain surgery. So
yeah, and you need to have your pushy nurse practitioner or pushy nurse friends in your team to be able to help you if you ever are, God forbid, in the hospital. So my husband knows if anything happens to me and I'm not able to advocate for myself and talk and communicate, Tracy and Jackie are to be called and sent to me immediately to be at my bedside to make sure I'm okay, because I know I'll be fine and they'll take care of everything. So we have that pact. So it's always good to have those nurse friends and medical people in your life that are family and friends that can help you through things. But go ahead. What did Romana say? I can't see.
My daughter has a brain aneurysm. So scary.
Yeah.
It's very scary. But hopefully, and I don't, so Romana, sorry,
Yeah,
I'm
she's
horrible
an awesome
names.
friend of mine. Romana, you got to meet. She's amazing.
So Romana, you have at least Team Romana, and hopefully you're building a team specifically for your daughter and have a good team that are going to take care of her.
She's got me on her team because I'm on Romana's team.
Yeah, so you're
and then if you got me, then you know you got Tracy
yeah,
too.
I'm part of, yeah.
We're part of it.
And it's, if you have a good team, she'll be okay.
Yeah.
I've taken care of lots of patients with aneurysms who've done well, who've had a good team. So that's the important thing. And you're going to be I don't know if how old is her daughter?
In her 20s.
Okay, so Mom, I hate to tell you this, she's the captain of her own team, but you can be the co-captain of her team, but she is the captain.
Yeah, I'll actually have to link you guys up because Romana has told me some more, and I don't want to say anything personal about her family medical history or anything on here without her saying it.
Mona said she's
29, diagnosed 18 months ago. Yeah.
Okay.
Yeah, she was actually diagnosed accidentally, just by offering to do a scan to help out the testing of the machine, and they diagnosed it as her being just a volunteer to help out with setting up the equipment.
Nice.
Yeah.
Yeah, my brain tumor, they were looking at my ears to see if I had an infection, and I saw my brain tumor on my ear MRI.
She said it's not operable at this point.
But I'm sure they're watching her and keeping an eye on it, and there's not only surgical options but intravascular options, and so again, if she's got a good team, they're going to take care of her. And what's her daughter's name?
Oh, I don't know.
Romana, what's your daughter's name? Shout it out here when you get a chance.
Yeah.
And we'll start rooting for her team.
Yeah. And then Lexi, hey, how you doing, girl? Good to see you on here tonight. Non-operable at this point. Did anyone say something after her? Because it's blocked on our
It
thing.
says yes, watching it. That was Ramona.
Okay,
Good.
so she'll give us her
Good.
name and we'll shout out for her team. If there's any other questions, Tracy gave us some. I mean, I knew that she was going to be fabulous, so I did not stress when we were like trying to figure out what would be a great topic because I knew.
And is Bailey Polk.
All right, so Bailey, we're looking for Team Bailey.
We're doing it. We're doing it. We
Team
got
Bailey.
you.
So Bailey's the captain, Romana's the co-captain. We'll be
part of your team.
I'm good at catching a football. I can throw a football. If football's not your sport, we'll pick another sport for an analogy.
And then we're Team Romana because, well, you know, offline I'll tell you stuff about Romana that I don't want to share unless she shares, and then her husband also. Yeah. So we're on all three. So we got the whole family. We're on your team. Yeah. Romana's awesome.
Now,
She's
I
a great
do like to tell people I'm like a fungus. I grow on you slowly, and then you can't get rid of me.
That is the truth. You can't shake her. But that's okay. We love her.
There's no cream. Even Arbonne has nothing that will make me go away.
They really don't because Arbonne is great. Thanks for the shout out. I don't even pay her for this. She's doing this for free.
So she promised to make me a smoothie tomorrow.
I am making her a smoothie tomorrow and a detox tea.
Ramona
Because
says tears streaming. Thanks, guys.
Oh, we got your back, girl.
yeah, absolutely,
We got your back.
absolutely, Ramona, always.
Why, does that make me a cheap date that I'll work for a smoothie?
Well, you've always been a cheap date.
So this will make it hard for me to negotiate my next contract.
We're family. You can't have a contract with me. You know.
No,
you're
but my next actual job contract, I'm gonna have to think on this one.
Oh no, I've already got a job for you and a vision for you, and we're gonna get her on YouTube. Wouldn't she be great on YouTube? I told her we got to start this because we have this whole circle light thing that my kids told. She's laughing. We have this whole circle light thing that my kids told me about when I started doing these live Facebooks because we're medical. We don't know all this like YouTubing video stuff. So I did my first video on a rickety internet kept crashing, and my little laptop computer with the camera and it was dim, and everyone's like, no, you need this ring light thing. So I brought in this old snazzy setup, and she's like, what are you doing? I'm like, we're going live. You're going to be on with me.
She's like, you're going to be on tonight. I'm doing what?
Yeah. She's like, what are we going to talk about? I'm like, I don't know. I trust that we're going to figure something out. I trust you because I know you. I mean, if we can do the things we've done together between work and life together, this is cakewalk. And I know that she would be fantastic on a cheap date. I know this would be fantastic if she did something on YouTube, and we can get her back on here on these weekly lives because she's just fantastic at speaking and educating. Go ahead.
Alana says you're hired. Sign her up.
Because I work for Smoothies?
Yeah, smoothies. Yeah, we got to get her out to Oklahoma too, Ramona.
So instead of being ACNP, I'll be the smooth NP. Smoothie NP.
Oh, I like that.
Smooth.
Oh, yeah.
But then I have to speak in my smooth jazz voice.
Ooh. Oh, yeah.
So again, talking about being part of your
jazz
team.
voice. She can play the sax too. What'd Nana say?
Nana said, awesome segment, girls. You two are great together. Take it on the road.
We really could. I knew if I got her on here with me, we would feed off of each other.
We could use our husbands as our business managers.
Yeah, I don't know. Should we?
Oh, Eric would be a good business
Okay, I don't know about Damon. Well, I love you, but I don't know. You might drive me a little crazy if I took you on the road with me.
If anybody has any questions, throw them out.
Yeah.
I was going to say, other people, if you've had experience with your healthcare team, shout them out. You know, I know Wendy knows what it's like to have a good healthcare team.
Yeah, for sure.
And I've been on Wendy's healthcare team, and I've been on her husband's healthcare team.
And my healthcare team with my son, with my mom's stuff, and then with Alex, with my son Alex, when we were in North Carolina, I went through a lot. And as his mom, even though you're medical, doesn't mean that when it's your family member you think is clearly, or you're more, we talked about this, all these things, it's really funny. They're coming together full circle from everything we've been talking about the last few days without even realizing. Isn't that crazy? Mm-hmm. But when you're emotionally invested or involved with a loved one, it's harder to think clearly like you would if you're a nurse or a provider on the outside. Even though there's an emotional connection and relationship, you think clearly and you do things differently than if it's your immediate family member. So when it was my son, when we were in North Carolina, there were things going on that I was absolutely overwhelmed, and I would call and vent or ask Tracy for help, and she's like, do this, and this. I'm like, why didn't I think of that? But it was just having that sounding board to be on my team to help give me what I needed to do the next step, because it was really hard when it was my kid. So yeah, we've done life for a long time together. So is there any questions on there that they have for us? Because we are hitting about, I don't want to keep everyone on too long, but we're just having so much fun.
We could go all night.
We could, so I don't want to hold you guys too long. But if anyone has a question, go for it. Otherwise, we'll go ahead and we'll shut this down.
Listening to Lynn, this is from Nana. I got Bob in with my vascular doc and found he had a huge blood clot.
Has a huge blood clot?
A blood clot from listening to me when we were talking about things. That's right.
Where is that coming?
No, blood clot in his leg.
In his leg.
In his leg, because he was complaining of a lot of leg pain, and I believe it was unilateral. So blood clots are typically not in both legs. So typically you will have swelling, redness, and pain and difficulty in one leg. So if you have swelling in both legs, that's usually more like heart failure or kidney problems, right? So he had, when I started figuring out, because he has a restless leg syndrome, but when I started honing in on it, I realized it was more unilateral. He had some other risk factors. I sent him in to see the vascular doctor and get a Doppler of his legs, which is basically an ultrasound, no radiation or anything, and it's an easy way to diagnose. And yeah, they did find that huge blood clot, Mom, you're right. And then they had to treat it and put him on medication for it.
And it's important to catch those early because they can travel from your leg up to your heart, into your lungs, and then that can cause an even greater problem. So when that happens, then they come and see me in the ICU.
Yeah, no, that's right. That's exactly what you see them for. And it's called a PE, a pulmonary embolism. So if you hear the word, I know a lot of you have heard pulmonary embolism, scary thing. It's from a lot of times the DVT, and it goes up and it goes into your lung. And those are scary. We had a bunch of ICU patients with that one back in the day when I worked ICU with you.
Well, and I'm doing pulmonary critical care right now, so I'm part of the pulmonary embolism response team.
Ooh.
So anytime anything comes in, we have a multidisciplinary team where we use vascular as well as pulmonary critical care medicine, and we come up with the best plan for treating a blood clot to the lung or a pulmonary embolism to have the least long-lasting effects and to give people the best outcome.
Absolutely. So no, that was good, Mom. All right, guys, it looks like we don't have any more questions. Is there anything on your end, Mia? All right.
I'm sending hugs, especially Wendy.
Air hugs, air hugs.
Wendy, Nana, Andrea.
Woo!
Hugs.
So I will get her back on here again. This is going to be something we do again. Oh, what did Romana say?
We were told my hubby needs to see.
Oh, it got cut off, Romana. Go ahead and put that in for us, and we want to read it. We were told
A vascular surgeon.
a vascular surgeon, a vascular surgeon. So can't wait to see you, Tracy. Thank you, Tracy. It was good to see you. So yeah, Romana, vascular, because her husband is his background's firefighter and I believe paramedic, and he had a widowmaker.
Oh, okay.
Yeah, it was crazy.
He's an aortic aneurysm. Okay.
So his aortic aneurysm, right?
Yep. So vascular surgeon are the people to see. It is probably, if it's vascular surgeon, it's probably in his abdomen. And what they'll do, depending on the size, they'll monitor it. Sometimes they can do an open surgery. Other times they can go through the vein into the leg and put a graft in. There's multiple options.
I think he was like a 3.3 or a 3.5 centimeters, so
So
they're
they'll be
watching
watching
him
it, yeah.
aggressively because usually they wait till it's 5 or greater, right? And depending if it's higher risk, it's 4 to 5. They'll work
Right.
on
Yeah,
it.
she said it was in the abdomen.
Yep, and they're probably all over him about his blood pressure because high blood pressure can cause that aneurysm to form and can cause it to get bigger. So I'm sure they're watching him closely. 3.2.
3.2. Oh, good. It was smaller than I thought. I was thinking 3.3 to 3.5. That's good. Because usually, right, is it elective 4 to 5 and greater than 5 a definite? And not elective, but they look at your risk factors versus
Right.
the benefit when you're in the 4 to 5 range, and other things go into it. Because, medicine, it's never black and white, guys. There's so many things that get involved. That's why it's an art. That's why things take time when you're in the office. If you're meeting with someone, a provider, because it's never black and white. We have to really look through you individually, because what happens on one isn't necessarily the same for the next one. We have guidelines to go by, but not everything's always the same.
She said you had perfect.
Oh, good. That's really, really
That's
good.
awesome. That's so
Thank
important.
God.
So important.
Thank God.
Yeah, I like to tell people this is going to shock you, but as providers, we don't know everything.
No, I'm kidding. I'm kidding.
We don't know everything.
We don't.
I like to tell people we're kind of detectives. We look at clues
Mm-hmm.
and we try to piece the clues together to figure out who done it. We form a suspect list.
I love the way you approach that. That's exactly what we do.
We
In my
form a
head, I've
suspect
got
list.
like these algorithms going.
Which is technically a differential diagnosis. We form a suspect list, and then I try to interrogate and figure out who the bad guy is and get him.
And sometimes we consult each other to figure out, hey,
Oh, yeah.
help
Other
look at
detectives.
this. Yeah, more eyes on it to help kind of see things that you might not be seeing, or maybe they had experience with something similar that you didn't. So that's why we like to share information with each other to help diagnose and treat. But yeah, no, absolutely, I love that. It truly is. We are detectives. That's what's so great about this is that if you go in and build a relationship and listen and get the good history and you're willing to take the time with people, you can really do so much. Come to Florida, laughing out loud. We need you. Lex, she's awesome. I love Lexi. What did Romana say after that, Mia?
Thank you both so much.
Oh, absolutely.
Got your back.
And I think she said something underneath Lexi.
She said, Lexi, we need you on our bond team.
She said that to who?
Lexi, I think.
Yeah.
Oh, to Lexi. She said we need you on our butt.
We can come visit you in Florida, Romana said.
Oh,
After the
sweet.
hurricane.
After. Yeah, no, Tracy will go on the road with me. I think we need an RV and an Arbonne. We can decorate it with Arbonne on the side, and we'll go on the road. I think this could be a thing, guys.
Maybe some bail money.
Yeah, we would definitely need bail money.
We may need some
Damon
bail money.
could bail us out. Eric could help manage, and Damon could be our bailout and our security. I think this could be a thing. We could do really well. We could do like Where in the World is Traci and Linnea?
Oh, jeez.
Could you imagine with our little ring light, where'd we go? We'd have all different backgrounds and different stories.
I think we should do one of them from surfing on top of the RV while the other's driving.
Oh, I like that. That could be good. Definitely wear a helmet though. We're trauma background. Wear a helmet. You want to be safe, right?
Jackie said, "Can I drive?"
Jackie said, "Can she
Yeah,
drive?"
absolutely,
You're totally
Jackie.
in, Jackie. You think we would leave you out of this? There's no way.
Jackie's a phenomenal driver, so yeah, she knows what she said. Plus, Jackie doesn't want to talk. She's got to plan. Oh, sorry guys, I'm driving. I can't talk.
I know her.
And those of you who don't know, she's laughing her hiney off right now that I said that.
She absolutely is. She's like, busy. I have my role. I have my job. And my friend Amy has the RV. She has a huge RV right now. So we could take that on the road. We got the RV. We've got a driver. We've got security. We've got a business manager. We'll go on. I'll get this one on the air with my ring light. It'll be great. I think this could be a good thing. We could like just go across the country.
I think you should do an episode ringlets with the ring light.
Ooh, I like that.
Make her have ringlets for one of them.
Ringlets?
I think you should all tell her.
I'll try.
I don't know if you type like, tap. I don't know. But tell her she needs to
comment afterwards. But this was a great segment. Is there any more questions? What did Romana say? Mom said your elixir buzz. They may wonder if it's got tie-dye and we might go the wrong direction.
We don't want them to think we're moonshine runners.
That's hilarious. And then Jackie, and what did Romana say after that?
My hubby wants to buy me an RV to go on the Arbonne Road.
All right,
There you
sweet
go.
Romana, you're already part of the team. I'm part of your team. You're part of our team. So you get the RV. We've got a driver. Let's roll. We could do it. We could like caravan because we've got Amy's RV too.
We'll be set.
And we'll be set. And anyone else who wants to hop along, I mean, this could be serious. We could go with a whole caravan of people cross country and take on the nation and do this everywhere. It'd be fun, right? So we're going to go ahead and wrap it up. But this was like my favorite live. So I really appreciate it because the dynamic of having her, like all the years of experience we've had together, and I know her so well. Literally, she came rolling in like a minute before we were ready to go live, but I knew she was coming.
We were fishing.
I know. And Mia caught the catfish out of all of them, a huge one, and they gave it back. They put it back because we're not going to eat it.
We're humane. That's right.
But I will try to get her on again the next time I have her with me. Coming to your city soon. That's right, Nana.
We may not want to announce that we're coming to your city soon. They may not let us in.
Yeah, that's true. We have to go on the DL. Thanks, Romana. I'm so glad you guys could all join us. I knew this was going to be fantastic because Trace, I've just known her so well. I mean, we've lived together before, so
yeah.
we are like we are
You
sisters.
said that you went fishing. No, you did not go fishing. Me and Tracy and Eric fished.
Oh,
That's right.
I did not go fishing.
No, she wasn't fishing.
Because I was inside doing a Zoom call, but Mia had never fished. I have. And of course, Aunt Trey needed to be the one to teach her off the dock in the backyard.
With the beautiful sun setting in the distance.
Yeah, we have a pretty good view back here. So that's what they were doing while I was working.
We were getting into our Zen spot so I could be
So you could do the
channeled and calm and ready to communicate with all of you.
And roll in a minute before. I'm like, she's got this. We're good. If I have to carry the ring light out there, I will. But we will see you. I will see you next week. And as soon as I get back here to get this girl on camera, or I will have her do it. I could have her send me something to put on, but I think she's way better live. We'll do the is that like the Queen's wave? We'll do the Queen wave. Okay, guys, take care. Bye.